Hi everybody, my name's Richard. I'm 64 years old and I'm a practicing family doctor. This past year I had both knees replaced, one at a time, and after my surgery I was sent home. But I had a lot of questions about how I would recover from the surgery. I wondered if I could go up steps when I first got home. I wondered how much pain I would have and for how long. And I wondered if I was progressing as I should be, if I was doing my exercises correctly. I was lucky to have my wife home with me, and she helped me out a lot so that I didn't need to go to the nursing home after surgery. She also drove me to therapy the first few weeks. I know that I drove her a bit mad with my recovery, and being the sensitive guy that I am, I tried not to irritate her too much. Anyway, everyone heals differently and at different rates. Some people are in good shape prior to surgery, some people are not. Some people are really old, and some are young. So as you view my video, you should realize that everyone's experience is going to be different. I'm also hoping that this video will help you understand a little bit about what actually happens when you go home after surgery. I spent 2 nights in the hospital after each knee surgery, and I went home 2 days after the surgery was completed. I was lucky too. I didn't have a blood clot, I didn't get any infection. These things happen even if you do everything correctly, but they don't occur very often. Finally, if I had to do it again, I'd do it a little differently. I would do more upper body exercises for the 2 or 3 months prior to surgery so that I could handle myself better the first few weeks after surgery when I was on my crutches. Upper body strength would also help in getting onto and off of the toilet. That's all for now. Getting ready for surgery, August 23rd, 2016. Putting all my stuff in a bag. Bag. Okay, I'm out of surgery, about maybe half hour out of surgery. Left knee, and coming along. Post-op day 1, it's about 18 hours after surgery, and things are going good. I have a little drain in there at the top of the dressing right there. And this is an ice pack here, and we're going to get a little dressing change here. Things are moving around okay. Okay, so this is about 15 hours after surgery. Just kind of putting a new dressing in place. But the knee's looking pretty damn good. Okay, so I'm at post-op day 1, about 20 hours from surgery, and the physical therapists are getting ready for me to walk here. So let's see what I do here. They got a gait belt on me. You can expect that, a gait belt.
Does it feel balanced?
And we're pretty good, so I'm going to start walking.
Okay.
That's good. Very good. And that's probably good enough to... I don't want to... One thing I forgot to mention was that when you have surgery, they inject my knee with a lot of local anesthetic, and it wears off after about 24 hours. So staying in the hospital for 2 nights is probably a good idea, because when the anesthetic wears off, got a fair amount of pain. Okay, that's all for now. This is my second post-op day. I'm taking Vicodin 2 tablets every 4 hours through the night last night that helped me get some sleep because of the knee pain. The knee is still pretty stiff, but it's coming along. I have to walk up and down some stairs today before I get out of here to demonstrate that I can do some stairs so that when I go home, I can get in the house.
Alright, so any questions, I guess?
Are you going to get a prescription for medicine?
Yes. Oh yeah, I already have it. I printed it off yesterday already.
Okay, thank you.
Yeah, so it's in your chart so they can get it filled out.
Okay, well here I am, post-op day number 2. I'm home for about 3 or 4 hours right now, walking around on crutches, still taking my Vicodin, but it's doing okay. So I'm in physical therapy. This is post-op day 3. Started my outpatient physical therapy, and my physical therapist is working with me to try and improve my strength and my range of motion. Hi everybody, it's my 4th post-op day, and I'm on to 1 crutch now. I had been on 2 crutches, but doing 1 crutch, so that was an achievement. I can go up and down stairs a little bit, and my Vicodin use has decreased from using 2 tablets every 4 hours. Now I'm using
2 tablets twice a day. I'm using ibuprofen. Also, the constipation thing is a real thing. Today I was able to move my bowels, but it's day 4, so that was kind of sticky, such is life. I don't like to talk about it, but there it is. And finally, I emphasize that you got to do your exercises 3 or 4 times a day. That really helps keep things moving. And that's all I got for post-op day 4. Here we are at post-op day number 6. And the thing I noticed mostly was that in the past day or 2, I got a lot more swelling in my knee area that I hadn't had before, so it's a little bit more stiff. And I wanted to show you that because that did not appear right away, but here we'll kind of take a picture of it and just show you how much swelling there is now. And Gail, talk to me. Tell me how.
Okay, it's good.
Okay, so it's just a lot more swollen now, and otherwise it's doing okay. I have a massage therapist coming to the house today to help out with the swelling. A lot of people can't do that, but I think it's going to help out with the swelling. And finally, just a few words about the Vicodin use. If you use too much, that's not good, but if you use too little, that's not good either. So it's kind of a balance. Right now I'm at about 2 Vicodin per day on post-op day 6. That's all for today. Thank you. Okay. At post-op day number 8, and I'm going to take a shower today, my first shower. We sealed the leg up with this press and seal, and after the shower I'll take that off and dry everything off. But that's how you do it. I'm at about day 8 right now. Thank you. Post-op day number 9, and I've switched away from my crutches and I'm using a cane now to get around with, so I can walk around a little bit better. Every knee is different. Some knees take a long time to get off the crutches, some are faster. So this one was, I think, fairly fast. I found that today I could put socks on and take socks off. That was a big deal for day 9 for me. And let's see, I guess the biggest thing is every knee heals different. Some of them take longer, some of them shorter. But we are post-op day 10, and I'm at the doctor's office, and the nurse is going to take my staples out today. I'll take a little picture of that. The staples there, just getting ready to get those taken out. And today is post-op day 11, and a couple little things. I still get pain in my knee at nighttime, so at nighttime I'm still using some Vicodin, but I'm not using it the rest of the day. And at this point in time, day 11, I'm still going up the stairs like this, 1 stair at a time. 1 stair at a time. I'm not yet doing stair, 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 just 1 at a time. So that's all I got for today. Hey everybody, it's me again. I'm at 16 days now after surgery, and as you can see, I'm not using a cane or crutches. I still use it sometimes, but now I can also go up the stairs kind of slowly, 1 step at a time. But 16 days, you know, that's not too bad. I'm still going to physical therapy twice a week, and I'm doing my exercises 3 times a day, every day. Using a little Vicodin for pain at night, but not too much, just once a day, usually in the evening. And I'm also driving a car now at 16 days, so that's what I got. Thanks a lot. One other thing that I forgot to mention is that I did have some skin surgery on my nose, so I have a nasty looking nose and a Band-Aid on it, but I didn't fall down. It's just that I had a skin surgery done. Hi everybody, we're at day 24 now, which is week 3, day 3, so 24 days out, and just wanted to show you coming down the stairs. Well, let's see, I'm pretty good. There we go, down the stairs like that, so that's coming along pretty good. Obviously no cane or walker, and I'm driving a car now. And I go to physical therapy twice a week, and I'm doing my exercises 3 times a day at home, so everything's coming along pretty good. I'm not back to work yet. I'm still off of work. Hi everybody. It is exactly 4 weeks since my surgery now, so I can even walk backwards, eh? So I'm walking backwards a little bit, walking frontwards, and with my left knee, this is about 4 weeks right now out. Left knee was done. And I'm still going to physical therapy several times a week, doing my daily exercises. And now I'm taking the dog on a walk 1 or 2 miles a day as well. So that's what I got right now. Also, now 6 weeks out after my surgery. and I'm doing good with my knee surgery. The only thing I need to say is that you need to do your knee exercises every single day for the rest of your life. But I'm doing well, and thanks a lot.
After my second surgery, I went hunting in the mountains of Montana about 11 weeks after the actual surgery. My legs, they were still a little bit weak, but I managed to hike in and out of the mountains with very little pain. My friends sometimes help me carry items, but hiking into the mountains with a backpack and a rifle 11 weeks after surgery is incredible to me. I'm really grateful to have had a good surgery and also a good surgeon. Also, at this time, I'd say that my knees are still a little bit stiff when I first get going, but the further I walk, the less they are stiff. Prior to my surgery, I had been limping around for 2 years, and the further I walked, the worse it got. One other thing, after my surgery, it had been difficult for me to kneel. I have a lack of sensation of the skin which overlies the kneecap, and it feels good not to kneel. I think this is a common problem for people who've had a knee replacement. And finally, I'd say I'm 64 years old. I'm hoping that my new knees last me the rest of my life. I think they ought to last 20 years. You know, that's a lifetime guarantee for me. I hope my video helps you out in the days and the weeks after your surgery. Thank you.